Good morning, everyone. Today I'm going to present to all of you my topic about sexual self. Sexual self refers to the totality of oneself as a sexual being, including positive and negative concepts and feelings. According to theorists, sexual self concept is described well along three dimensions: the sexual self esteem, sexual depression, and sexual preoccupation. First is the sexual self esteem. It is the feeling capable of being involved in sexual practices with successful procedures and results. Sexual self-esteem tends to differ with age and one's partner's sexual skills or interests, and it may vary for men and women and across cultures. Studies also suggest that sexual self-esteem is negatively affected by a variety of life experiences, including childhood sexual abuse, sexual victimization, physical disabilities, and health issues. Another study found that sexual self-esteem is positively associated with general self-esteem. More broadly, many cultures push us to restrict our thoughts about sexuality and to develop low sexual confidence. Others tie sexual self-esteem to ideals of beauty and attractiveness. Who has the highest levels of sexual self-esteem? Many think that married people have the highest level of sexual self-worth. After all, the one person they are with already knows them very well and they likely don't feel threatened by that person. Competition is low and ideas of beauty and attractiveness are fading over time. Moreover, many cultures sanction and idolize marriages, and it only makes sense that married people would feel better about themselves. However, my new findings suggest that this is not the case when it comes to sexual self-esteem. Second is the sexual depression. How are sexual problems with depression or with antidepressant treated? If you have depression and are noticing reduced interest in sex or problems with sexual functioning, it is important for you and your doctor to figure out if the cause of sexual dysfunction is depression. These are the ways to manage the sexual side effects of antidepressant medicines without compromising treatment. Your doctor might try newer antidepressants that may not dampen the libido or sexual response, and they may prescribe another medication to try to counteract sexual side effects, which can taken in tandem with the antidepressant. Sleep and depression. If you've been diagnosed with depression, you may be having trouble getting to sleep or staying asleep. There's a reason for that. There is a definite link between lack of sleep and depression. In fact, one of the common signs of depression is insomnia and an inability to fall and stay asleep. What types of sexual problems are associated with antidepressants? First is the inability to initiate or enjoy sex. Second is the erectile dysfunction or delayed ejaculation for men, decreased sexual desire, and the last is inability to achieve an orgasm. And the last is the sexual preoccupation. It is the term used in this article. Sexual preoccupation is defined as sexual behavior that deviates from normative practices in terms of frequency and or choice of object and creates domestic, occupational, or legal problems for individuals. What's the compulsive sexual behavior? It is sometimes called hypersexuality disorder, or sexual addiction. It's an excessive preoccupation with sexual fantasies, urges, or behaviors that is difficult to control, causes you distress, or negatively affect your health, job, relationships, or other part of your life. What does it mean to be sexually preoccupied? The term used in this article, sexual preoccupation, is defined as sexual behavior that deviates from normative practice in terms of frequency and or choice of objects and creates domestic, occupational, or legal problems for the individual. What causes hypersexuality? The causes of hypersexuality behavior are not well understood. However, sex addiction and hypersexuality may sometimes be caused by traumatic experiences, distress, or by mental illness, such as bipolar disorder. Adults who have been sexually abused as children may display increased sexual behavior. What causes nymphomania? It is the underlying cause of nymphomania is not known. Nymphomania is a mental and emotional condition, and like other such condition, is complicated. Like other mental illnesses, nymphomania may arise as a result of environment, heredity, and life events. It may also be linked to a chemical imbalance in the brain. What does hypersexuality feel like? It is also referred to as compulsive sexual behavior or sexual addiction. Hypersexuality is described as dysfunctional preoccupation with sexual fantasies, urge, or behaviors that are difficult to control. What ages do females become sexually active? According to experts, 18 is the right age for both men and women to become sexually active. How can a woman stop arousal? Engage in a relaxing activity before sex, communicate your desires, talk about boundaries, don't be afraid to ask questions, and talk to a therapist.